start. I'm gonna laugh. I have such a bad problem with laughing. Okay. Hello, Mr. What is it? Matthew Natali? How are you feeling today?
Terrible.
Okay, what seems to be the problem?
Well, I came in because I've had a high temperature and I've been having trouble sleeping, waking up with some nightmares and
Night sweat?
sweating. Yes.
You seem tired now. I see bags under your eyes. Have you been sleeping much at all? You're suffering from fatigue?
Yes, I am suffering from fatigue.
Oh, okay. Okay. I see you're coughing. Is that cough been persistent over the last, whatever length of time you would say?
Yes, very persistent.
Okay. It also kind of looks like your lymph nodes are swollen. And okay, so that's usually sometimes a symptom of the cold or flu symptoms. Let's see. We just use. Okay, it seems like your head is a little bit hot. Definitely a fever. Okay, so these lymph nodes, they seem exceptionally swollen though. How long would you say that you've had these symptoms?
At least a couple weeks now.
Okay, but what about the lymph nodes? How about that? Like under here? This area?
About 3 months.
3 months? That's a very long time to be having such symptoms. That's curious. Okay. Well, we're definitely going to run some tests. Seems to be something, this combination of symptoms seems to be something maybe with your immune system. So let me just ask you a couple of questions. Okay, so I've asked you how long you've had these symptoms. Are there any drugs in your system, known drugs in your system at this time?
No.
Have you used drugs in the past?
Yes.
Okay, what kind of drugs did you use?
PCP, acid, heroin.
Heroin. Did you use a needle to inject yourself with the heroin?
Yes.
Okay. About how long ago was that?
Maybe 5 years ago.
Okay, so you've been clean for the last 5 years or so?
Yes.
Okay. Now using needles and such is dangerous when you are, do you know if these needles were clean? What was the location in which you were using the drugs most often?
At my friend's house.
And did you share a needle?
Yes.
That is very bad. There are lots of different diseases that can come from that. What about your sexual partners? How many would you say that you've had in the last 5 to 7 years?
Maybe 40, 50.
40 or 50. That is a large number of people. Would you say that you knew all of these people intimately?
No.
Okay. So that's another thing. It's definitely a good idea to get tested for a lot of different things. Something that I want to test you for today is the T lymphocytes in your cells to see what's going on with your immune system, because this combination of symptoms seems quite chronic in my opinion. I'll think back. Miss Hallie, how have you been since I've been gone?
Yeah, a little bit better.
Okay, hopefully that's from the rest that you've been getting laying here. Okay, so I have your test results for you, and I tested you for a wide range of different diseases. Based on what you told me about your sexual history, I tested you for a lot of STDs and things of that nature, just to ensure that we don't miss anything here. And other disorders that can come from chronic drug use. I know that you said that you got clean 5 years ago, but still there are things that can linger on even past that point. But I also tested you for autoimmune disease, just because the combination of your symptoms seemed like something more was going on that met the eye, more than the cold, flu, persistent cough, and fevers. Just seemed a little bit too much for me. So the unfortunate news that I do have for you is that if you look at this chart here, we tested your T lymphocytes levels, and the mm³ rate of them is at less than 400 in your bloodstream, which is a low rate. Actually, what this tells us is that we can safely presume that you had HIV. In the there are 3 phases of HIV before it becomes AIDS, A, B, and C, and you are at the B phase, which is known as chronic, as opposed to acute, which is in the first few years after you're infected with the disease. Because it's probably gone unnoticed for approximately 5 years or so, which is when you said you got clean actually, so that makes a lot of sense. It could even be a little bit more time than that. So what we'll start you on is a wide range of drugs that will seek to eliminate your symptoms as best as possible and to stop the reverse transcriptase in the retrovirus that is HIV. And hopefully with those mix of drugs we can slow down the progression of the disease and prevent it from mutating as much as possible to ensure that you can be healthy as long as possible. I'm sorry for your disease.
How can you be sure?
Well, our tests are fairly accurate when it comes to these kinds of things, and sometimes in the first 6 months after you are come into contact with HIV, you don't necessarily demonstrate the symptoms that you're having, but these range of symptoms and these T lymphocyte levels are definitely very, definitely HIV. I'm sorry.